You're live.
All right, we're back. This is Senate Health and Welfare. We're looking at an amendment that we asked Green Mountain Care Board and the hospitals to work on, and they've come back with a recommendation that's a combination of what I had put up yesterday, the hospitals had put up, and what the board had put up. And Jenna, you're going to tell us what we have.
I am. Good morning, Jen Carpy from the Office of Legislative Counsel. This is an amendment to S-190. And it's the language we looked at yesterday. So I've incorporated that without any highlights anymore. So this is using that actual, one of the editors took the comma out. So now it's just actual hospital specific Medicare reimbursement rate as the definition, and then a 225% cap for enrollees in qualified health plans. And then a new instance of amendment that would amend provision of section 3, which was the hospital budget and budget review chapter in the bill. And there's that new section in section 9459 that says hospitals should first implement commercial rate reductions from their budget orders by targeting the qualified health plans. And then if they still need to reduce rates more, they go for the rates that are more than 500% of the Medicare rate, or if they don't have any of those, the highest ones relative to the Medicare rate. And then there was language in C that said if a hospital shows the board that the limitations on its rates for the qualified health plans or those other very high rates are having a negative impact on access, quality, or sustainability of care, then the hospital can propose to increase the rates for service lines, and the board would consider both the demonstrated impact and the proposed increase. This would strike that language and put in instead, except as provided in subsections A and B and in 33 VSA section 1815. So except as we've already specifically said around the 225% cap and target the highest rates as a percentage of Medicare if you still need to do more rate reductions. A hospital may increase the commercial reimbursement rates for one or more of its service lines, such as primary care, provided that in doing so, the hospital remains compliant with the total budget ordered for the hospital by the board under section 9456. So allowing the hospital then not to go through the board to increase those rates. They can't affect what you've already put in place for the qualified health plans and the highest rates if that's something they're directed to do in the budget order, but otherwise they can adjust their other commercial reimbursement rates.
And so in the timeline on this, this goes on until such time as
so the QHP cap goes on until such time as the Green Mountain Care Board sets a different rate than 225%. And there isn't a specific provision sunsetting this piece.
well, wouldn't this piece go along with that?
It could. I mean, there may be adjustments. There may be rates set as part of overall rate setting. But there was no expiration date to your,
Yeah,
I believe.
I don't think it was
Working
earlier.
now. But yeah, there's no, the language that is in 9459 directs hospitals to implement commercial rate reductions through the QHP cap first. And then if they have to make further reductions, then by reducing rates in excess of 500% of Medicare rate, if we change the term, let me change the term up here.
Just wondering if this should be consistent. I'm looking at if this should go along with the board makes establishes its.
I don't know if that's necessary to.
Does it matter?
I mean, I think the board is going to be making changes. We're going to have to update the statutes to reflect what the board does
Okay.
as things roll out.
Okay. All right. So this is a compromise that was reached with the board and the hospitals.
Right.
That we got.
Emily Brown is on.
754.
Emily Brown is on the Zoom as well. If you are wanting to hear anything from the board.
I didn't hear you. Sorry.
Emily Brown is on the Zoom as well. If there's anything you're wanting to hear from the board.
Oh, yes. Board.
Stop my.
Who's there? Emily is here. Thank you, Em. Emily. Good morning. It's a tough day for any parent in the room. I understand. So very quickly, a comment from the board and from Boz would be helpful.
Sure, of course. Thank you. Emily Brown, the Executive Director at the Green Mountain Care Board. Yesterday we got together with Voz and discussed, the amended language of the definition of the Medicare adjusted base rate, and agree that at this point in time, based on feedback from the hospitals and the insurers, it makes sense to use the Voz suggested definition, with an acknowledgement that in rulemaking, once we move towards reference-based pricing, that might change. But to make sure this is able to be implemented in the time that the bill proposes, we agree that having the definition be adjusted to what the actual Medicare rate the hospitals are paid makes sense. We also came to an agreement that the percentage should be lower, or used as kind of a placeholder until we are able to do more analysis, to make sure that the 225, which was replacing the 250 in the original language, is the right place. We are planning on in continuing that work, and making sure that's the right landing place for the QHP plans as well as the hospitals. And then there was also some adjusted language in there around basically if the hospitals implement the QHP adjustment, we wanted it to be clear that as long as they're meeting their budget guidance, that there wouldn't be a further expectation of reduced rates. So I think it's a good place, and I want to thank Devin for working with us on this, and for the committee for giving us the chance to take this back.
Thank you. That's really helpful. And thank you for doing that work at a difficult time. I know it's never easy, but I know how busy everyone is. Yeah. Devin
Green from, excuse me, Devin Green, Vermont Association of Hospitals and Health Systems. And I would also like to thank both Emily Brown and Elena Bearbank from the Green Mountain Care Board for their work on this. We really appreciate the thoughtful conversation that we had with them. And it is laid out as Emily Brown mentioned, and we would just say that the 225 is a placeholder until we can figure out something that is manageable both for the QHP and the hospitals. So thanks.
Okay. No, good. Good. That's good. I know it's hard to put categorical things in. So I'm hoping that can resolve this ASAP. I know that's not possible. I know there's a lot of work that goes on in analyzing what's possible. But thank you for your work. And so we have gotten to a good place, committee. This is a proposed amendment that will be bringing to the Senate, and I'm happy to add signatures to this, and I'm looking at my committee if you'd like to sign on. Is there anybody who wants to sign on?
I'll sign on it, but I have a question though.
Sure.
So we don't have the bill, right?
It's in appropriations, and appropriations doesn't want to touch this with a 10-foot pole. Unfortunately, it's not their jurisdiction. They're not we're policy.
Okay.
So they suggested that we work on this, and we've worked on it. And now I am reassuring appropriations that they're taking the money out that's in our bill. We'll have the language that will support both the board and the hospitals, especially.
So there will be amendment on the.
Yes, it will. I'll put it in the calendar.
Right. Sounds like everybody wants, because you don't have the bill, possession of the
Right.
bill, it can't come from
Yeah.
this committee. It
Right.
comes from the individual members,
Okay.
as many members as want to be on it. So it sounds like everybody.
Is everybody okay? Is there
Yeah.
anybody who does not want to be on it?
All right, then I'll put the chair first and then alphabetical.
Awesome. This is good. This is good. Thank you all. Is there anything else? I'm working on 193 with judiciary right now, and they found one thing they want to cross out on it, and I'll keep you apprised of that proposal amendment. They crossed out one phrase that I suggested to them because they were concerned about one of the parts of the description of the facility for the facility. So we're gonna sort out, and Senator Harrison is in there now, and I hope she's not messing up our proposal, but no, she's not too good. So I'm gonna go back there and I'll keep you informed about that, amendment. But thank you all. We call it a wrap today, and you've all done great work and I appreciate it.